So the question is, how do we know if the machine is working properly? My brother has one, but nothing is coming out anymore, and we don't know if it is working or not. So this is a common misunderstanding among patients and with nurses. They think if there's no drainage going into the wound vac canister, then the machine must not be working. But that is not the case. So most wounds will drain very little, if anything at all, and that is not a cause for concern. On the other hand, if a wound is draining a lot, then that is a bigger cause for concern. In order to make sure your machine is working properly, you want to make sure it's on and running and that there is no air leak or blockage alarm showing on the machine. You also want to check the dressing to make sure it has a sucked down appearance. So it should kind of look like a raisin. It should not be puffy, and you should not hear any air escaping from under the dressing area. So if the machine is running and not alarming, the dressing has a nice sucked down appearance, and you don't hear any weird noises, then chances are your machine is working properly.